Susie Pond, and I'm from Sydney, and I feel very privileged being in front of all of you amazing people. My background is in physiotherapy, and I'm trained as a Pilates instructor. I started dance when I was about 5, and tend towards modern dance style now. I've done a little bit of lecturing at different dance degree courses, and just have a passion for anything to do with safe dance, which is injury prevention. So I thought today I'd give you a little bit of an insight into dance medicine, which has links to sports medicine as well. And I look at bone health, which goes from, so next slide please, across spectrum of ages, from quite young dancers who can be a bit, can you hear? Oh, next slide, thanks. From quite young people who might be vulnerable to stress reactions or stress fractures in their bones, or fractures as a young dancer doing something amazing, through to an older age group who wants to continue dancing but wants to do it in a safe way for their body. And so I'm looking at the ways to help either prevent or manage these conditions in a way that keeps us dancing. So next slide please. I wanted to just have a quick mention of safe dance, which looks at a definition which is all to do with a holistic look at health. So health, as the World Health Organization defines, is a state of complete physical, mental and social well-being, not merely just an absence of disease or infirmity, and we would probably add spiritual health to that as well for our purposes. When people like me, health practitioners, are working in that sort of space, we think of preventing injuries. So the primary look at things would be prevention. Secondary tier of treating people would be more screening for issues that could be given. So like I would do a pre-point assessment for a dancer, a ballet dancer, before they go on point shoes to pick up any issues about their alignment or strength that could make them vulnerable to injury. That's the sort of, I do other sorts of assessments as well and screening things in other ways of health. You can see that happening to help people prevent injury. And then if something does happen, then you've got people who can help you heal, physically heal, socially heal, mentally heal from whatever health issue you might have. So it's all about that caring for people, loving people in that way. Next slide, please. So as safe dance, we look at informing ourselves with studies that tell us, what sort of injuries are people getting. So how can you help prevent an injury if you don't know what is the issue? What are the issues here? So we're looking at people doing studies on the types and areas of dance-related injuries. So in a big contemporary or ballet company, they might do some stats on where's the injury, how's it happened, what are the perceived causes. And also they look at the hours of dance and the load on people. So some people have a huge load, kids who are doing a lot of hours dancing, and so look at their patterns that might contribute. Is the injury related to fatigue? Are they not getting enough sleep? And so these days we've got a whole lot of new ways to assess that. The body monitors for the amount of stress on a person, or a monitor about how many times they bend their back a certain way, monitors about their sleep patterns, things like that, which all contribute to sports and dance-related injury. So what we're looking at is intrinsic factors that might put us at risk. So it's something inside our body, things like our alignment, our bony makeup, our strength, things inside our body that might contribute or risk of injury. And then extrinsic things, so things outside, our costumes, our flooring, management issues on how much stress people are under, things like that can contribute to injury. Okay, so that's next slide please. So if you do have a musculoskeletal problem. There are people who you can go and talk to about helping you heal that from a health and medical point of view. So doctors and sports physicians are involved. When you're talking about bone health, you might talk to an endocrinologist, so specialists that look at the body's hormones and how that affects the body systems, metabolism. In Australia, we're lucky to have physios who are really well trained and lots of different allied health practitioners with a special interest in dance, like podiatrists, and I know there are a couple of New Zealand podiatrists here who very up there with, but they could do 3-point assessments too that looked at the whole body, not just the foot. And then when it comes to looking after dancers and helping prevent injury, your teachers, we as teachers and the teachers we're involved with, have a knowledge of how to look after you and how to care for their dancers to help prevent injury. So when we're talking about bone health, nutritionists and dietitians have a big role to play in helping inform people about how to keep their bones healthy. Because nutrition has a big effect, hormones have a big effect, and the amount of stress we put through our bones has an effect on how healthy they are. Okay, next slide. So dance-related injury can be defined as a physical problem derived from stress or other causes to do with performance, rehearsal, training, touring or other circumstances in dance life. And this affects the ability for us to participate in normal dance training, performance or physical activity. In Australia we have all these safe dance reports which were done over the years. There's 4 or 5 of them now, and they did a whole lot of study talking to professional dancers and in ballet companies, contemporary companies and independent dancers, and then collated that stuff about the sorts of injuries they're getting, their perceived causes. And one of the latest ones was done by Amy from Sydney, and that was her definition of what the dance-related injury was. Okay. Next slide, please. And so from a summary of the sorts of injuries that are prevalent from these studies, they found that the most commonly affected area were the ankle, the knee, and then the hip. And the sorts of injuries that they were could be a strained muscle, a chronic inflammation, or a sprain. Now, sprain is you sprain ligaments. So ligaments join bone to bone. They support and limit unwanted movement in a joint. So, say, like rolling your ankle, that would be straining a ligament, a sprained ligament. A study done by Deb Cruikshanks, before that, it was a similar sort of thing, but low back was more prevalent than hip and knee in her back in the day when she did her study. And then if you look at studies from different parts of the world, you get similar, but with some differences. So in professional contemporary dancers, in the UK, I think that one was Sharp, most common area, again, foot and ankle, low back and knee. And then just recently, I went to this fabulous International Dance Medicine and Science Conference in Italy. Yes, it was great. Where there was a woman who is a health professional and researcher for the Paris Opera Ballet. And her recent longitudinal sort of study came up with foot, ankle and lower leg as being the most prevalent. So that's a ballet company that does a lot of load. You know, they're doing a lot of repetitive movements, a lot of footwork on point, things like that. So different to a company that might have more of a contemporary thing. So I didn't have enough room because we had a hip hop guy there, and we had a lady from a contemporary company from Louise Drysdale in Queensland who had thoracic injuries involved, you know, up there as well. So that maybe their sorts of work just reflected the sorts of injuries. But because a lot of these big studies are done on professional ballet and contemporary companies, that's why we're getting this stuff about foot and ankle. And I suppose that's a little bit of our experience as well. You know, sprained ankle is one of the most commonly experienced things that we might have as a dancer. Anyway, all healable or fixable, right? Next slide, please. Okay, So the dancers reported perceived causes of their injury. So they say, well, what was leading up to this? What helped it? And that fatigue was one of the big ones. So at the end of your rehearsal, we'll just do that one more time. They're already fatigued, not good. Don't do it one more time if you're too tired, because that's when you're perhaps a little vulnerable to rolling wrinkle, to whatever. Overtraining had a big part of some of this sort of work, and these mainly younger dancers. Now, a lot of the dancers in these studies are probably under 30, I would say. New or difficult choreography, ignoring early warning signs, and the Aussie Ballet found this as a big one. So if people go to their physio or to their doctor early on and say, look, I'm not sure if this is a problem, it's niggling a bit, and the physio goes, oh, you've got not enough ankle bend and there's a bit of tightness under here, let's release that. They were finding that then that prevented them becoming injured, so that brought their injury rates down a lot by just reporting things a bit early. Hazardous surroundings, so things like poorly sprung floors, ripped tarquette. People had colleagues with cuts on the bottom of their feet from tarquette edges and things like that. Costumes. I treated a girl many years ago who was doing jetés across the stage in her Lion King, and she had a stress fracture on the side of her transverse process in her lumbar spine. It was like no one could work out what was going on, but the costume was hitting into her as she did these jumps, So yeah, it can be anything, let's face it. So when you go on stage, look at, is there a wire in the way? Is it slippery? Has someone spilled a drink? You've got to do your own health and safety sometimes in the places where you go. Anyway, lack of warm-up was one of the perceived causes, so just going and chucking that high kick without warming up. That's a good hamstring strain story there. Inadequate nutrition for energy requirements, and this has become a big discussion at that international conference overseas, and I'll talk a little bit more about that. Just muscle imbalances and lack of adequate strength for the task. Maybe your body's carrying certain habits that then put strain on a certain side of the body more than others, so balancing things out is always important. And faulty technique, so sickling the foot, going up on a rise with the foot rolling in or out too far. If you've done repetitively, it can be a problem. Trying to balance without the tummy muscles on, can we actually do that? Probably not. So things like that. Anyway, so they're just just a few things that can be perceived as causes. And when you're looking at safe dance, how can you use some of those things, your knowledge about those things, then to go on to prevent injury? Great, okay, next slide. If you're talking specifically about bone injuries for dancers, then the most common areas are listed there. And if you just want to grab a foot for a moment, okay, put your hand on your ankle, so the inside shin area, that's one of the most common for stress-related reactions, so that's your shin splints. If you go down to your second toe across, and think about where the big toe and the little toe is. If your second metatarsal is longer and you're doing demi-point all the time, that can put more pressure through that second metatarsal head, so that's that red one down the bottom there. The navicular is a bone on the inside of the ankle. The fifth metatarsal base there, that's got a muscle attaching to it. And you see this more in elite ballet dancers who are trying to turn out from their foot rather than their hip. So they're trying to twist, and the lateral fibular one there too. You see that in ballet dancers who are trying to turn out too often from their foot rather than from their hip. And then it just puts us, you're not supposed to rotate from there, right? The only rotation comes from the hip. So that's kind of things. And then very common in any extension-based sport, gymnastics, fast bowling and cricket, things like that. Stress fractures in the lumbar spine are quite common, you look out for them. So if a kid comes to you and they've been doing a lot of acro or that backward bending and they're complaining of back pain, you don't think discs and stuff like you would with our age group, with our flexion-based degenerative disc things. That kid may have stress fracture because they've got a little bone in their back and they're going back against it, there's a growth plate there. That bone still isn't quite healed, so it's not as strong. So they talk about the cricket players, they shouldn't do fast folding until they're 25 when their growth plates are closed, you know. So with dancers, we're a bit more even often, although with arabesque it's one-sided. So the back stress can be limited by having good abdominal control, hip flexor length, strength around certain areas, and not, you know, having technique that shares the extension load with the whole spine, not just of that one spot. Yeah. Okay, so I'll keep going. So they're mainly seen in younger people, but older people can get stress fractures as well. I don't know if any of you guys have. Next slide, please. And so factors that might lead to the risk of stress fracture would be, again, that overuse, training, poor shock absorbent floors, things as dancers we all have a kind of a knowledge about, yeah? I think we're all pretty lucky because nice springy floors in church halls, that's a great floor, right? There's not a bit of spring in that, but not with concrete straight underneath the wood. Watch out for that. But and what if you're doing outdoors dancing, you know, on the concrete? How would you modify your choreography to help prevent this sort of thing from happening? Any ideas? Sports shoe, wear a sports shoe, wear a shoe with some spring in it, yeah? And just or take some of the jumping out of the choreography if that is the case, yeah. Lack of hip external rotation control into excessive lower leg twist, lack of ideal soleus length, so bend the ankle. So if you just want to stand up for a sec and just do a demi-plie in parallel. Does one of your ankles bend more than the other? It's really important to have good length. You've got two calf muscles going to your calf, going to your Achilles tendon. The stretch for one is with a straight leg, and the second stretch is with the bent leg. So you need to do both stretches to stretch the ankle bend depth in your calf. And say if you're going down the stairs and you don't have enough bend in one ankle, you cheat and you roll your foot and your knee when you're going down the stairs. So you need adequate ankle bend for plie depth, jump landing, just general life, without having to compensate up through the body in other ways. Yeah. Then we're getting into more metabolic things. So a lot of some dancers and athletes who over-exercise actually become amenorrheic. They lose their periods or they become irregular. And that can put their bones at risk because without your estrogen and testosterone are protective for your bones, and that can lead to a problem. And then even poor sleep patterns and fatigue and smoking, interestingly, and diet are sort of things that you might think about if you're dealing with a dancer with stress fractures. Next slide, please. This is REDS is a thing that they're talking about quite a lot at the moment in the dance scene, professional dance scene. So people who want that beautiful aesthetic skinny look, overtrain and don't have enough nutrition to support that level of energy needed for that level of dance, and lose their periods. They then have resultant bone density issues and many other health issues. And unfortunately, if it keeps on going for a long time, they become infertile, they have all sorts of ongoing problems. So it's very hard for the endocrinologist to actually diagnose it and look at it. And now there's a big paper that's just come out from the Australian Ballet, and I've put the reference at the end there, if anyone's interested to read, about a multi-team approach to care for dancers and pick up early signs of people to help prevent this, but also help support people who have this problem or who are leading on trying to prevent the problem from happening is the best thing. And like a big group like the Aussie Ballet are very involved in trying to help people with that and prevent that from happening. Next slide. So a person might talk about abnormal eating, they're not getting ideal nutrition for high level of energy, mental dysfunction, and low bone density for one's age. which would put them at risk of stress fractures and other injuries. Yep. Next slide. Okay, so this is our skeleton. It's a living tissue. It's a place for muscles and ligaments to attach. It protects our organs. It builds red blood cells, and it stores calcium and magnesium and other things. So it's very complicated. Next slide. This is how your bones grow. We start at cartilage when we're naught, and then over time we have little growth plates. We start to calcify, and then the bones grow either side of those growth plates, called the epiphyseal plate. And this is one of the things we're looking at when I do a 3-point screen on the dancer, which you want them going straight through their toes and not putting uneven pressure through their growth plates in their toes or their leg when they're on point, for example, or any sort of dance, with a theory that it could prevent bony tissue and joint damage later on in life. Okay, next slide. So I just wanted to show you that bones remold all the time. You've got some bone cells that are bone forming and some bone cells that are bone resorbing, and you have a total replacement of your skeleton every 7 to 10 years. So next slide. Yep. And so this is the graph that is really interesting. So when you start in your life at naught down the bottom, and you have a rapid growth of bone density, so as your body's laying down the calcium and getting to a certain point, a little bit less for females and males, and then by your 20s, you should have reached your peak bone density. So if you had any of those problems that we talked about earlier, that's going to be disrupting how you achieve your peak bone density. So then that is achieved by mid-30s, and then as we get older, it starts to decrease a little bit. And unfortunately, as we go to menopause, us women get a 5% drop immediately when osteoporosis, when menopause happens. So, and then there's a bit of a tapering off there. For men, it's not quite as excessive there. So next slide. So just keep that in mind, because this is how we're going to protect our young dancers and also protect other people, that if you advise them to reach their peak bone density by a certain age, less problem later on in life of fractures and problems with falls. So, so 80 to 90% of your bone density occurs before the age of 19 or 20. Everyone's growth, when they finish growing, happens a bit differently. 5 to 10% increase as you get to your peak bone density, and then you should have reached it by 35, and it's normal to lose 5% bone mineral density prior to the first phase of menopause. Next slide. So, things that will influence that, lots and lots of factors: genetic, nutritional, gastrointestinal. If you're not absorbing stuff, your nutrients properly, how can you then keep your bones healthy? Circulation, hormones, very important, and physical. Bone responds to the stresses we put on it. So let's have a look at that quickly. So there's modifiable things. You can't modify your age, your gender, your genetic or ethnic disposition, early menopause, or previous fragility factor, but there are some other things that can be modified. Falls risk is a big one. So if you have osteoporosis and you have a fall, then you're perhaps more at risk of fracturing something. But if you don't fall, you're not going to break anything, are you? Yay! So that's what dance is great for, isn't it? Balance, coordination, putting the load through the bones. Okay, next slide. So a gradual build-up of exercise and mechanical stress on bones increases your bone density. So there is a situation in your bones that will help lay down and stimulate the cells that make bone, the osteoblasts. Next slide. Yep. So this is interesting. Professional swimmers and cyclists have decreased bone density compared to age-matched athletes. Postmenopausal women who do acroaerobics have decreased bone mineral density compared to their age-matched people. Astronauts go into space and lose bone because they don't have the gravitational effect on it. So they come back and they've got these machines up there with the vibration and stuff like that helps them keep their bone density up. So if you're a tennis player, your right arm might have thicker bone than the left arm. It might also have thicker bone tissues like the tendons and muscles. And high and unusual impact weight-bearing sports with rapid rates of loading, such as gymnastics, volleyball, dance, basketball, and football, powerlifting, all those sorts of things are better for bone density increases. So you see the pattern? The bone is a living tissue that will respond to the stresses that you put onto it. Okay, but it needs to be gradual. Next slide. Yes? No? Next slide, please. Yeah. So that's a picture of your normal bone. Now, in your bone, you have hard bone on the outside, it's called cortical bone, and inside you've got the trabecular bone, which is like the honeycomb stuff. And in a bone density, decreased bone density situation, you lose more trabecular bone. That's more at risk. And so your scaffolding isn't as good. Your horizontal and vertical struts aren't as supporting each other enough. Okay, next slide. So what you need to look at to keep those bone health issues is have the tests, look at your vitamin D and parathyroid hormone, which are contributing to good bone health. If a person is on medication like corticosteroids, that can actually be not so good for your bone density. Falls risk is not so good for your bone density, and posture. So that if we're like this, that's going to compress some of those little vertebrae in your spine. So the straight posture and back extension is very important. So yes, we all sit up. Have a next slide, please. Next slide. Yeah. If you do have a bone mineral density test, this is what it looks like. If you have a score above 1 in the green phase, that's normal bone density. The doctor refers you for this test. The middle bit, under 1 to 2.5, is low bone density, called osteopenia. And then very low bone density is under 2.5, minus 2.5 is osteoporotic. And they take the test from the hip and the wrist and the lumbar spine. You can confer that the thoracic area where the ribs are would be about the same as down here in the lumbar, because they can't do a test on that because the ribs are away from the scan thing. So they just do lumbar spine, hip and wrist. Okay, next slide. Everyone, I think we've got that. Next slide. Okay, this is what we're trying to prevent. Crush fractures in the spine. So they're the sorts of things. So a normal vertebral body has a nice square kind of cylinder to it, but you can lose height on the front sort of part of the vertebrae, because the bit at the back is a bit protective. So it's thicker cortical hard bone. The bit at the front has the hard bone and the little honeycomb thing in the middle of the trabecular bone, the spongy bone. So that's more at risk of the compression fractures. So this is what we're trying to do. So over to this side is the front, and this side is the back. So that's where your back bones. You can feel those bits that stick out the back, the spinous processes. Okay, next slide. And this is one of the complications of what can happen in osteoporosis that isn't treated, and osteoporosis where a person doesn't look after their spine very well. And so you see the loss of height of spine. How many fingers can you put between your rib cage and your pelvis? So that's one of the tests for, how much compression has happened through the spine there. Yeah. Now, this is based on some studies by Sanaki, and she's done more since then. They looked at a group of people who did extension-based exercises, so lying on their tummy doing extension stuff, people who just did flexion-based exercises, which is this movement, people who did a combination of flexion-extension, and then a control group who didn't do any exercise. Okay, so the people in the A group who did main extension exercise, that loss of vertebral height that we saw in the last slide, 16% of those people, the group that did the flexion-based exercises, like sit-ups and things like that, 89% had lost vertebral height. So isn't that interesting? Yeah, so it's not if you're going to have a vertebral fracture, it's when you're going to have a vertebral fracture in that sort of case. And then it goes down a little bit for people who haven't done this same sort of exercise. Okay, so this is for people with osteoporosis. This isn't everyone. This is osteopenia, osteoporosis. This is the risk, yeah. So, good, it came out. No, my little figures have come out. This is a recommendation. So, stay positive, dance, stay encouraged. When I first got a diagnosis of osteoporosis, it's in the family, I was a bit like, oh, dear. But I've learned over the years to go, you can manage this, it's going to be good. And then, so stay positive, keep dancing, basically. Incorporate impact weight-bearing exercises and progressive strength exercises to increase your bone strength. Healthy balanced diet. My endocrinologist says to me, if you had your 2 doses of calcium, in the morning and the night, yes, I've had my yogurt, I've had my cheese, I've not rinsing milk that much, but that's probably one of my risk factors. Avoid spinal flexion under load. So sit-ups, that yoga exercise where you put your legs over your head, roll your legs over the head, very bad for the vertebral bodies. That's contraindicated exercise. So in Pilates, that's called a rollover. Not good. If you have osteoporosis, you are going to pop something in there. It's not good. Falls prevention. So balance and strength exercises. Very good. Okay, so let's have a quick look at those. That's next. Weight-bearing exercise. Now there's this researcher from Queensland, Belinda Beck. There's a reference for it. It's hard reading. This is the simplification of the reading. But relatively few impacts. Okay, everyone up would do this bit. So we're going to do heel taps. Okay, so standing up, unless you've got some contraindications, you're taking impact through your own. Let's do them. 1, 2, 7. Let's do stomping. Yeah, jumping if you want. Yeah, yeah, good. Right, kicking 3 to 7 times a week to stimulate response to benefit. It's going to benefit your hips and your feet more than your spine. Okay? Then, so it can be anything from heel taps through to more advanced vertical multi-directional jumping, bounding, hopping, and skipping. Sometimes after a lady has a fractured wrist in the hospital system, they'll send them to a class where they do specific bone density exercises, and it might be a netball game or something that they're having to run around a bit, do something different. Okay, then you have to look at the exercise that it's graded for particular people, because you don't want to have a high-risk person who's very fragile doing this sort of stuff, because it can actually be so you need some help working out who will do this stuff. Okay, next slide. Okay, this is the weight bearing stuff. So this is your weights, with squats above the head, or body weight exercises like planks and things like that. Yeah, with a nice straight back. Then, so this is the hip hinge. Imagine you've got a pole along your back and you're hinging from the back, so the chest is lifted and not doing the bend. So that's it, just doing that. So how would you do a roll down if you had quite severe osteoporosis? You'd probably hinge from the hip more, see? Right, go there. Just not going to go there. Put your tummy in and come up, then come up. So you just modify the way you do things. You're not stopping dancing, but you modify how you do it. And then, so we want to protect people from fracture. We want to strengthen the back extensors, get a nice posture, nice and straight and long, hip hinge, work on balance and mobility, and stay positive, because maybe creator loves us and wants us to look after our temple. Thank you. Okay, and then just my next one. ask me any questions.
Thank you.